had a conversation was sparked for me at ABA International Conference this past weekend, this is June, this was May, around inappropriate sexual behavior. And really, most of the time, these behaviors are appropriate in that, like, these are just human behavior, but they're inappropriate because of, like, the who, the where, the why, like where they're happening, when they're happening, who they're happening in front of is what makes them inappropriate. So I just wanted to flag that, like, nothing about these behaviors generally is, like, inappropriate in and of itself, but when we start to get into the definition of inappropriate sexual behavior, we'll see why some behaviors might be deemed as inappropriate at certain times. And so this is just another prompt to sort of, I'm hoping that people will sort of think about this as, like, the least useful part of this presentation. I hope that people will focus on the first parts from this morning and think about what is typical sexual health development, how can I teach this proactively so that we're doing less of this reactive support plan development for people. So prevention is key. I mean, this is like, that's just like a health thing, right? We know that with lots of things in like medicine and all kinds of stuff. If we can think about prevention, then we don't have to do as much damage control afterwards. So there's some content here that I hope will be useful, but I hope that people recognize that, like, we want to prevent it from getting to this place. And so reference back to the slides earlier of, like, how we can contribute to a safer, healthier education so that we don't get to this place. Having said that, I recognize that we may get to this place regardless, and some of us may be in this place right now, and so we still do need to talk about it. And so again, just another prompt for you to sort of, like, think, and you can share in the chat if you want. If I say inappropriate sexual behavior, like, what kind of things come to mind? Like, what have you seen in your child? What have you seen at the place that you work? What are some things that are sort of coming to mind when we say inappropriate sexual behavior? I think it's important, as a behavior analyst, that we really make a clear definition of what we're talking about here. So, masturbation, not an inappropriate sexual behavior. Masturbating in a public place, inappropriate sexual behavior, unless there's a whole bunch of things kind of set up around consent and that. But we're probably not talking about that sort of example for the people that you're here thinking about today. So what is a definition of inappropriate sexual behavior? And so I have a few different things. First is it occurring well beyond an expected age range? So again, it's very hard to sort of, like, put things into tiny, neat little boxes around, like, you should have this behavior happening now. I'm sure people, have seen this with just development in general. You might be thinking of your child and thinking, like, they're doing things a little bit later than all of their peers. And that might be okay, right? That's the pace of learning. But if we're thinking about sexual behavior and the ranges of ages that I talked about earlier, if it's occurring well beyond that age range, that might be getting into inappropriate sexual behavior territory, right? So enjoys being nude, 0 to 5, probably fine. Enjoys being nude at 15, probably less okay, unless we're at some place where everyone around has consented that this is a nude space. So there's lots of areas that we have to consider, but think about those age ranges and what might be expected to be typical. Is the behavior occurring in a public place when it really should only be occurring in a private place? This is, a lot for the, like, disrobing, masturbation, some of those sorts of things. Sometimes having, like, sexual conversations, but sexual conversations do usually happen in public. They just happen in public with particular people. So instead of, like, clear black and white rules, which we know that lots of people that we're supporting and your children probably have a lot of, though, like, they want black and white rules. And this is something that it's hard because there aren't a lot of black and white rules. What about if it's dangerous for themselves or for other people? So this could be physically dangerous. It could be emotionally or psychologically dangerous for other people. and how can we help to support people to help to make sure that their health and safety is being protected, and the health and safety of other people around them and the rights of other people around them is also being respected. So these are sort of the first three criteria for what I might look at asking people these kinds of questions to determine whether something is an inappropriate sexual behavior. Is it a violation of a policy or a law? And this is where it's like, that might not be inappropriate sexual behavior, it's illegal sexual behavior. It's just illegal behavior, right? Touching somebody without their consent, sexual assault, we can just call those things sexual assault. That is illegal behavior. We can name it as such. And so we need to know, like, if it's a violation of a policy or a law, then we need to think about how we can help to address it. And the last one is like, is this interfering with learning, community placement, being able to access environments? And what does that mean for the quality of life for the kids that you're caring for or supporting? Something like, I've worked with a lot of clients that have some sort of inappropriate sexual behavior at like public pools, which we may see sort of like a bit of a resurgence of because so many people haven't had access to those spaces for so long. And now coming out of the pandemic, maybe we're accessing those spaces, more people are around, right? There's like less clothes, there's hot tub jets, there's pool jets, there's, there's change rooms, there's all sorts of rules. But if a person has inappropriate sexual behavior, and then we're sort of saying like they can no longer go to the public pool, but they love the pool, it's their favorite thing. So that inappropriate sexual behavior is preventing them from accessing a community space. And so I think it's important to say like that deserves some investigation and some support for those types of interfering behaviors. Are they being restricted in their movements within a home, within a school? Are they having less and less access to peers? Are they having fewer support staff that can work with them because of people's discomfort? All of that stuff is contributing to just like a shrinking social circle and ability for people to access spaces that we want them to have a right to access. And so another thing here that is super important that I think people just kind of like jump over for behavior analysts, we think about this often, but sometimes also we can forget because it's in our ethical code that we need to rule out medical or biological causes. And this is definitely true for inappropriate sexual behavior or sexual behaviors because medical causes can contribute significantly to these. I've had a number of cases where I've chatted with people in like a brief referral, and we've been able to determine that it probably is a medical cause resulting in some of these behaviors. So super important for caregivers and care providers and for parents to think about too. I know access to medical care can be a real challenge and a real issue, so I want to like state and acknowledge that, but I do think that it is really important. So a few things that I've seen and that we need to keep in mind are that there can be infections, so urinary tract infections, sexually transmitted infections, yeast or bacterial infections through people. And people sort of think, like, well, they're not sexually active, so they wouldn't have an STI. Well, there's some like STIs that you don't get from just sort of like sexual activity that involves some sort of like penetration, right? We can get STIs from like contact. But what if somebody was assaulted and we didn't know? They could have an STI. If somebody is on hormonal birth control to help regulate menstrual cycle, or they've chosen to be on birth control to prevent pregnancy, and then they're put on an antibiotic, they may develop a yeast infection. And so maybe that scratching of the vulva isn't about inappropriate sexual behavior, it's about somebody having an itchy vulva that needs to be treated medically. Medications, I have a typo, medications, particularly when it comes to masturbation and effective masturbation routines, a number of medications can have an impact on sensation and a person's ability to achieve an orgasm. And these are particularly true for medications that are SSRIs, and the classes of drugs, some of which might be sort of anti-anxiety medications, antidepressant medications, and antipsychotic medications potentially. And those are 3 broad categories of medication that I see lots of people that I support are on some of those medications. And there may be really very legitimate reasons why they need to be on those medications. But those medications may be interfering with a perfectly successful masturbation routine for somebody. Might now, if they have, at age 17, maybe they were put on an antidepressant medication very legitimately, but that antidepressant has these sexual side effects. So now a person used to be able to achieve an orgasm in their masturbation routine, and now they can't because of this medication. Physicians will sometimes describe these side effects to folks when they are prescribed a medication, but I think they're less likely to think about sexual side effects for the developmental disability, autism, disability communities in general, because they too are impacted by that spectrum that we talked about earlier and thinking that people are asexual or don't need the information. So medications. Do not modify or take anybody off of a medication without consultation closely with the prescribing physician, nurse practitioner, psychiatrist. But it's a question that might be worth asking. Another medical cause could be phimosis, which is when the foreskin doesn't retract fully over the glands of the penis. So when people get to be into puberty and they're having erections and their foreskin doesn't retract, that can cause a lot of pain and discomfort. So maybe that person is touching their penis. Maybe it's become like inflamed more readily. And so could that be contributing to what we would otherwise think of as an inappropriate sexual behavior? Finally, just dryness of skin and membranes, particularly for people with a vulva whose like vaginal secretions are going to change over the course of like the menstrual cycle, but also can be impacted by things like medication, birth control, and one medication that dries out mucous membranes that a lot of people are on, particularly like this time of year, is antihistamines, right? So for allergies, if somebody has seasonal allergies and they take an antihistamine, their vulva may become more dry because it's a mucous membrane and the medication doesn't know which mucous membranes to dry out. It just knows to dry out mucous membranes. And so maybe someone's scratching their vulva because of that dryness. And so maybe they just need help with applying like a safe lubricant to help with that vaginal dryness. So a bit of time spent on medical causes because I do think there's a lot of things that can impact, and it's very important to rule those out because we're not going to be able to do anything to impact a behavior if we're taking an environmental support approach and there's a medical or biological reason for the behavior.